Welcome back, and you're still watching SA Today right here on SABC News. 2020 has proven to be one of the most challenging years for the South African health system. The need to strengthen and improve existing structures within healthcare is a major concern which laid bare all the weaknesses in systems. How has the country coped, and where do we need to improve? We're joined by RH Bophelo CEO Quinton Zunga to tell us more. Thank you very much for joining us, Quinton.
Thank you, and thank you to your viewers.
Right, let's start with a helicopter view of how the public and the private health system braced the COVID-19 pandemic in as far as its ups and downs are concerned.
I think I would like to say that the private and the public did manage to avert a collapse of the system. We saw at the peak that the public sector still had a bit of capacity. There was mutual coordination through the various departments of health, and also there was an ability to shift resources into the public and private sector. So all in all, we never saw the overrun of the system we saw in other countries, which allowed the peak to be manageable in the case of South Africa.
So now, when you hone in on the strengths of the South African health system, I mean, like, we definitely have heard about people complaining about the quality system, the resources that are in place, short staffing and so forth. But at the end of the day, if you have a 90% recovery rate in this country, then should we be talking about the negatives, or they will be there, but excellence will be experienced as a result?
I think excellence was experienced. We're pretty happy with what the leadership of the Minister of Health, I think he did steer the country to a very manageable place. We also want to thank all the healthcare workers did put in the sacrifice needed. So there were a lot of positives that came out of how South Africa handled the pandemic. Ourselves as private sector, we availed our facilities to the government and to mining companies which use these facilities. So everyone came together to get a joint solution. And I think we can learn a lot of positives for other aspects of the country now, how we manage this healthcare pandemic. There's so many positives that came out that even right now, despite the whole world looking so ominous, we're still at a relatively manageable place.
Yeah, well, I mean, like, it's a good point you're raising when we're saying a manageable place. But then one wonders, will there be a letdown in the later stages? And I'll give you a comparative analysis of this. You remember that South Africa was called the crime capital of the world. But during the 2010 World Cup, I mean, they say no one performs better like when they are under pressure. And crime was really, fought in a very excellent way during that time. So South Africa has been under pressure of the COVID-19 pandemic. But after all this has been said and done, are we going to go back to zero?
I think we want to build from this platform. We need that joint coordination between public and private. And as you're aware, it's without the pressure of the pandemic, it wasn't going too well. I wouldn't say it's been solved and that after this, everything is going to work. There's still some big structural problems that need to be solved in that the public sector still sees 80% of the population and the private sector 20%, and both those spheres use about half of the healthcare spend. So the unequal distribution is still there. And maybe from this pandemic, we can actually start to say there is a potential platform we can work on. But it really needs us, captains of healthcare in the private sector and the public sector, to acknowledge this platform, the deficiencies, and how we can provide a much better platform coming out of there. And yes, like in the World Cup, we did it. In the pandemic, it's going well so far. And one needs to just, take a reflection and say, in the hard times, we can pull it. How do we make sure that in the good times, we can still do the same kind of coordination and joint approaches?
So now let's talk about the NHI. I mean, when you were going to add improvement in as far as quality healthcare is concerned, I mean, can you really compare a public hospital to a private hospital and say that you are introducing a health policy and you want to match the two? Are you not going to see the remnants of the one that is performing on the downside and thus preventing the quality and the excellence of the private healthcare system, which operates very well when it's alone? But when you bring the two together, can you really fuse the good and the bad?
It's a very good question. I think what's needed is a measured and gradual approach working together. It's definitely a big concern of different spheres that when the private sector and the public sector come together, there is not, in my view, enough facilities. So we need to start to say we need facilities that are going to be NHI compliant, i.e. the quality is high, whether you are in a private or public facility. That's the starting point. Our firm is looking to put 150 NHI compliant hospital across all province. And we think it will allow us to be able to defend a product. The government also needs to reinvest in the public hospitals. The quality is not up to scratch. All of this background work should be done now. So the platform coming out of the pandemic is let's build the health facilities for the future so that when you roll NHI, you actually have the product that actually meets everyone's satisfaction. And it is a valid satisfaction, especially for those who can afford to pay private healthcare right now, that they're going to end up in a sub-quality facility.
All right. So, Quinton, I don't want to sound like I'm singing praises for the private health sector here. I mean, like members of the public always complain about some private doctors not even wanting anything to do with medical aid schemes, where they say the patient must pay. They will go claim. And patients complaining that private healthcare is expensive. Now, how does South Africa get to experience affordable health care with no ins and outs, ups and downs, and people at the end of the day suffering, like cancer patients who cannot continue with their treatments, medical aid, getting exhausted? Just very briefly.
So what we need is to focus on efficiencies, the quality of the facility, the cost of putting the facility. We have reduced the cost for bringing facilities by 60%. Which means our cost of bringing facilities is very low. You need to focus on the right product. We are introducing a 500 Rand per month product for full coverage. And with that, you need to now look at the efficiency route of care. And unfortunately, right now, nobody is being compensated for being efficient. So once everyone comes into the net, they need an efficiency. You need to make doctors need to make, a health professional need to make money by efficiency, not by just seeing one patient and charging them a very exorbitant fee. That's where the solution is, and we need to focus on it together.
All right. Thank you so much for making time to speak to us on this assessment of the healthcare system post-COVID-19. Quinton is Quinton Zunga, the CEO of RH Bophelo, and of course speaking to us about his views concerning how we fared as a country concerning coping with the health systems and going forward. We're going to take a break and we'll be back.